Disturbing new details tonight about the dangerous combination of guns and children. Research in the New England Journal of Medicine shows the #1 cause of death for children ages 1 to 19 in 2020 was gun violence. And this is the first time this gruesome milestone has been reached, surpassing car crashes, overdoses, and cancer deaths. Our Emma Henderson looks at what's being done now to combat the problem right here in Northeast Ohio.
Between 2019 and 2020, more than 4,300 children died because of guns in the United States, according to CDC mortality data, a 29% increase in just 1 year.
You try to take a public health approach to the issue, which is really about prevention. It's about dealing with individuals that might be at risk. It's about dealing with individuals that have already been involved in the system.
Dan Flannery researches the cause of spikes in this type of violence, and as director of the Begun Center for Violence Prevention, is also looking at ways to address the root cause of the problem. That led him to work with Dr. Edward Barksdale Jr., chief of pediatric surgery at University Hospitals.
For me, this was not a surprise. We saw this crossover point in Cleveland about 8 to 10 years ago.
Barksdale founded the Anti-Fragility Initiative through the hospital after learning children who have been shot have a higher likelihood of coming back in with the same type of injury. So the program uses that moment when the child is hospitalized to intervene.
We're not focused on the guns. We're focused on the children and their families who are victims so that we can prevent them from being re-injured, re-victimized, or also prevent them from becoming perpetrators of violence.
Barksdale isn't surprised at this report and says it's also a sign of a syndemic, or what happens when two epidemics are happening at the same time, causing more harm. In this case, he says it's COVID and gun violence.
We had an existing violence epidemic. We developed a COVID epidemic, pandemic, and the two of those together brought much greater numbers of violence because it accentuated the despair.
Both men say there's a lot that needs to be done to address this violence. Barksdale says the key is to save lifetimes, not just help someone with a gunshot injury, but connect them with opportunities to achieve when they're healing. Reporting, Emma Henderson, 3 News.